Ambulance service, is the patient breathing?
Someone's been stabbed. He's about 14.
Oh my God, it's just collapsed.
Across the UK, more than 14 million 999 calls are made for an ambulance a year, with the North West Ambulance Service receiving a new cry for help every 20 seconds.
She doesn't think she's pregnant or didn't know, but she said she feels like she needs to push.
As the pressure builds,
There's absolutely no reason to talk to me like that. I'm trying to help you here.
the control room has to decide who will receive an ambulance
17-year-old male, cardiac arrest.
and who must wait.
We do have delays at the moment of up to 8 hours and 45 minutes.
No.
On the ground, ambulance crews race to save lives
It's been a serious road accident. Both drivers are in a serious condition.
and offer the best help they can.
Oh, it's been nice of you to come. You're ever so nice to talk to.
Tell you what, Norman, you're made of strong stuff.
Black pudding. I love a bit of black pudding.
From the picket line
Everyone's going on strike because no one can afford to live.
to the front line,
Are you going to be violent towards our crew?
this is the story of some of the darkest days in the history of our NHS.
He was quite happy to die on the streets of Manchester.
It's going to probably get a little bit worse before it gets better.
3276, unexploded bomb.
To my hometown. Beats Darwin.
Nothing beats Darwin.
Ambulance service, the patient breathing.
Sorry, what's happening?
I just need an ambulance urgently, please.
It's 1 hour into the night shift for the North West Ambulance Service,
Okay, is the breathing noisy?
No, he's just drunk.
and Control are already receiving a new 999 call every 19 seconds.
But at the moment, we're trying to determine if this patient is breathing effectively, because if she's not, we're going to have to start CPR. I understand that she's taken an overdose, but we need to do the right thing now, OK?
Right, you plug into that one.
On shift tonight is call handler Sarah, who is in training and answering 999 calls for the first time.
How are you feeling then?
OK, I think.
Yeah.
Yeah.
She'll be mentored by Michaela.
Just be prepared, because I can be an emotional wreck sometimes.
That's absolutely fine. When I started was
Yeah.
the biggest nervous wreck you could ever meet in your whole entire life.
Yes.
You've got this. We'll see what we get. Press ready when you're ready.
Ambulance service, is the patient breathing? Can you hear me?
Are you safe?
Are you safe?
No.
He's looking for you. Find somewhere safe. Is there a shop?
Is there a shop nearby?
No.
Try and find somewhere
Try and
safe.
find somewhere safe, OK.
Just put assaulted by voice. Just play the line.
Operator,
Can I help you?
has the line cleared?
It has, yeah.
Right, try and call her straight back. We need to try and get her somewhere safe.
The person you're calling.
Right, just hang up. We'll try her a couple more times because I'm just concerned for. Put it in the police desk. Yeah, and then let's try and ring her again. We'll try her a couple more times.
Come on.
Right, leave her a voicemail because if we ring it again, if she's not got it on silent, he might find her because it's ringing.
Hi, it's the ambulance service. Please, can you call us back immediately? Thank you.
Right, so we'll open pathways because we've got a kind of address. I mean, the police will probably go on a grade 1.
Bloody hell.
Are you all right?
That was scary, man.
A marker will be put on the caller's number and police will be dispatched on the fastest response.
Poor woman.
I know.
The night shift is in full swing. And with 106 ambulances covering the 1,200 square miles of Lancashire tonight, there are still 28 patients waiting for an ambulance.
Ambulance service, is the patient breathing?
He wasn't moving or he wasn't doing anything, but the missus has just said he's snoring. If I'm being honest, I think he's just had too much to drink.
Is the patient awake?
Yeah, kind of. She's on cocaine and weed. And she's gone over on her legs and she's screaming that she can't move.
With calls continuing to flood in, patients face delays of up to 30 minutes.
Can we have an ambulance, please?
Is the patient breathing?
Only just. He stabbed himself in the stomach a few times. It doesn't look great.
Is the patient breathing?
Don't leave him.
What's happened?
Well, the guy was on a moped. He's like my friend. Hit him wrong.
Okay, and what injuries has he got?
I think he's hit his head, so he's lying face down. His head's pissing me blood. He can't feel his left leg.
Just to confirm, did you say the person on the scooter was driven off?
Well done.
Okay.
Alpha 169.
An ambulance is immediately dispatched to the patient, along with QX120 Gareth. He is one of only 2 advanced paramedics covering the 3,800 square miles of Lancashire and Cumbria tonight.
120, go ahead.
Thanks very much. Just take point on this job. We're heading to a 43-year-old male and he's been hit by a scooter. They have to still action, a head injury.
Yeah, thanks, that's all received.
Gareth arrives in 15 minutes. Police and 1 ambulance crew are already on scene.
This is Johnny. Did it by motorbike. Now, they were saying about 50 or 60 miles an hour. So, coming down, head injury, forehead and partial removal of his left ear.
Good shot. Any pain relief so far?
Not yet.
Pain's at a 10.
Hey, Johnny. Listen, we're going to sort that pain out now, OK? You had morphine before? Yeah. We'll get that sorted for you, OK?
Definite open fracture there.
Yeah. Go on, keep going. That's it. Well done, mate. You're doing really well.
Can you just lift it slightly? I don't mind catching it.
Is this vehicle that's sitting stopped, or is it gone?
No, it's gonna run it.
Ready, brace, lift. Is that his body? It's hurting, yeah, OK, pal. So there's abrasions to the right flank.
I'm not feeling that.
What's that, pal?
I'm not feeling that side.
I think he said no feeling this side. Johnny, do you know what's happened to you tonight? Do you know?
No.
OK, don't worry yourself.
Dave said as he were crossing the road, a motorbike has come and just hit him and then run off.
OK, hold on in there, pal. Just some medicine going in your arm. I'm sure you've guessed already, but we'll be going over to Preston, the major trauma centre. Quite concerned about him. I'll get a pre-alerting for you.
QX120, go ahead.
120, thanks. I've got a major trauma pre-alert. When you're ready for details, please, over.
Yeah, go ahead.
43-year-old male, pedestrian, has been hit by a motorbike at high speed. He's had TXA, morphine, Cormaxiclav, and he will be having some paracetamol en route. ETA is going to be 25 minutes to Preston.
All received, I'll pass that on.
All right, gents. Been a pleasure as always.
A major trauma pre-alert, please.
Due to the severity of the injuries and in the hope of reattaching the patient's ear, he will be taken to Lancashire and Cumbria's only major trauma centre, 20 minutes away.
Well done. On your first night shift. Thanks. Have you ever done nights before?
A long time ago when I was about 17.
Oh, really?
Yeah, at Mackie D's, so it weren't anything major like this.
No way, you have to be fully alert.
Yeah. No, with this, you've got to be fully alert and fully awake.
QX120.
120.
Just a quick one, just to see how your night's been.
Yeah, thanks. Lots of broken limbs, lost ears. Let's hope they're all okay.
Fingers crossed and it's not too life-changing. Thank you very much for your time, Gareth. It is appreciated and I hope you sleep well.
Yeah, have a good sleep, pal. Ta-ra.
It's the start of the day shift for the team in control.
Morning, Tess.
Morning.
And they are already feeling the impact from the night shift.
The hospital been like?
It's not been great. We're just queuing for hours.
Across the northwest, 124 patients are waiting for an ambulance.
Alpha 169.
Responsible for dispatching the 58 ambulances across Blackpool and Cumbria are Graham and Angel.
Alpha 112, good morning. Got quite a lot of outstanding Cat 3s at the moment, oldest over 10 hours.
Are you in a bit of dire straits over there?
Just got Cat 3s at the minute.
For some reason, someone's turned a switch on and everyone's decided now it's time to ring the ambulance. Hopefully,
Yeah,
it might slow down a bit. I'll refrain from using that word.
fingers crossed.
And then it'll just clear the backlog, but
Yeah,
I'm not holding out much hope. We can only cross our fingers.
yeah.
Ambulance service, is the patient breathing?
I am the patient.
Well,
I'm a little drunk and I fell down the stairs. I landed on my face, bent into a funny shape on my way down. Oh, my partner's gonna kill me. I shouldn't be drinking.
Let's go.
Let's do this.
Lancaster crew Alpha 169, Jared, and student paramedic Asher are 2 minutes away from the patient.
But if it's intoxicated enough to fall down a flight of stairs, 9 o'clock in the morning,
And on a Wednesday?
might have some other things going on. If you're drunk this early on. So that on there. So extra cash. Yeah. Hello, mate. You all right?
Fell downstairs drunk. My partner's gonna kill me. I got to the top step and I literally rolled down the stairs and I landed on my face here and I feel it and my knee bent in a funny shape.
Can I just have a feel of your neck, mate? What's your name, sorry?
Gary.
Gary. Can you just lift your head up?
That hurts.
It hurts there.
It's tender there.
Tender there. Gareth, what we're going to need you to do, mate, we're going to need to have you flat on the floor because you've got pain right on your spine there. So we're going to have to immobilise you.
Just try not to move your neck, all right?
My grandma's dying. I was washing her and stuff the other day. It really upset me. I just started drinking and...
Are you quite close to your grandma? Yeah. Right, Gareth, we need to try and get you laid down on your back. Keep your head straight for me.
Even then when I'm just...
Yeah, all right. Just keep it straight.
Oh, it's so bad.
I know, just keep...
Mate.
Oh.
Just keep still for me while we get this collar on. You're all right, don't worry.
I'm an alcoholic, but since my grandma started dying, she's dying of a brain tumour.
Oh, man.
I love her so much.
Yeah.
She's only young, she's 68. The brain tumours took everything away.
Oh, mate, I'm so
and
sorry.
that's why I hit the bottle.
Keep going on gas now, mate. You're doing really well.
I wonder if we need another pair of hands, Jared, to move him.
Alpha 169, go ahead.
Yeah, just on this job, we just need another crew at the moment for extrication purposes. We're quite happy at the minute that we're not any major trauma at the moment, but we're just going to need to do another assessment.
Yeah, Roger. Is it P2 backup?
Yes, please.
32 miles away in Blackpool are Alpha 112, Isaac and Lauren.
Alpha 112, good morning. There's 5 outstanding jobs at the minute. We have whittled them down. We've got the oldest Cat 3 now, an hour and a half. I'm going to pop you into that job. It's come through as an alarm activation, no response. For a 53-year-old male.
Yeah, that's fine. We'll go and check this out and see if hopefully he's all right.
Alpha 112 are 3 minutes away from the Category 3 call for a patient who has activated their care alarm.
Might just be that he's asleep.
Probably. The last time I did something like that, it was the battery had run out.
Oh, yeah.
Yeah.
1.4 miles away, a new 999 call is in progress.
Is the patient breathing?
I can't breathe.
Tell me exactly what's happened.
Breathing.
You're having difficulty breathing?
I have COPD.
OK.
How old are you?
76.
Oh, stand down.
It is immediately decided to divert Alpha 112 to the patient as the call is a higher priority, Category 2.
Alpha 122, thank you, but I'm sorry, I've had to divert you to this Category 2 call. It's come through as a 76-year-old female. She's having difficulty in breathing and also has chest pain.
Amazing, thank you very much for that update. We'll make our way there now.
Have you rang an ambulance?
What do we call you? Catherine, my name is Isaac. So what's going on this morning?
I'm really short of breath. Is that your COPD, do we think? Yeah. Have you taken your inhalers?
Okay, sorry. It's got wheeze all over. How did you sleep last night?
Oh, I haven't slept.
No. Not able to lie down at all? No.
I went to a funeral on Monday and I might have cooked some it up.
Yeah?
Because I don't go out normally.
No.
Put this on you while you talk, all right? Yeah. And get your glasses. Thank you.
Oh. Tell you what, we'll have a chat with you once you've had that, OK? Because I just want to make sure you focus on getting that in. And then we'll have a chat, OK?
Can I put these stickers on you to see how your heart is beating? Okay.
I can't breathe.
I know, that's it. You're doing really well.
Oh, I'm panicking.
It's all right, yeah?
Yeah.
Try not to panic. I know it's easier said than done, OK?
Yeah.
Ready? So slow, deep breaths. That's better, OK? That feel a bit better? No. Right, let's get you on this wheelchair, OK?
I'm not good.
I know. You're doing really well, though, yeah?
No, I'm not.
You've improved loads.
I'm panicking.
No, you're fine. Come on, we've got you.
Okay.
30 miles away in Lancaster, an additional crew has arrived to help with the safe extrication of Gareth.
Ready? Yeah.
He will be taken into the nearest A&E at the Royal Lancaster Infirmary.
How are you feeling now, Gareth?
I've got a banging headache.
You will.
I feel like someone's punched me directly in my forehead and the back of my head. I'm just not used to having other people in control. I'm not used to other people being in control. I'm the caregiver. I'm not used to people doing the care.
We're bad patients, aren't we, when we're caregivers? But trust us that we will look after you. There's nothing bad's going to happen not while you're with us, all right? OK?
I know, I trust you.
If you want us to ring your partner, we will ring your partner. All right?
No, don't, he's at work. Don't ring anyone
Right,
yet.
OK.
Until I'm dying, you know what I mean?
Not today, you know, it's too much paperwork. I'm going to go and drive us to hospital. All right? Right.
Oh, I just need
Being a student paramedic, the jobs I would say that I find difficult and upsetting are the ones that are personal. My dad's been alcohol dependent all of my life. I had a lot of mental health when I was younger, growing up. But I suppose when you've been through things in life, I think it helps because you can empathise with people and really feel what they're feeling. I want to be that person that gives someone relief and help and sometimes hope.
Why is it so painful? I'm just venting, that's all. I'm sorry.
Oh, no,
I know
don't
I'm
be
really
daft.
grabby.
No, don't be daft.
I'm scared, the pain.
I know you're scared.
Going into resuscitation, thank you so much, sister. And you're in good hands with sister, they'll get you sorted.
Yeah. Just a little update on that last job. It's actually really nice that our last patient, Gareth, they've actually forwarded him to the alcohol liaison service for some help with his alcohol issues that you mentioned. So that's actually really nice to see, because obviously it's really sad for us when we see things like that, especially when it rings personal with our own circumstances as well.
Yeah, definitely that. Right, thank you very much for that update as well.
Brake put in.
Roger, that will do.
You're doing really well, OK?
Yeah, you're better now.
Good.
24 miles away, Kathleen is arriving at the Blackpool Victoria Hospital.
They're already ready for you. They're waiting.
They're cleaning the room for us.
Oh, right, they're just cleaning it
Yeah,
for
they'll
us,
come and
OK?
get us. Are we still smoking?
Yeah, I realise I've got cigarettes in there.
Only cigarettes? Oh.
No, I have one joint at a night.
Oh, okay. Why? It help you to sleep?
No, I do it because I got told I had arthritis.
Yeah.
And I'm still waiting for pain to kick in. And I swear it's down to the wacky-backy.
Wacky-backy? How does the wacky-backy make you feel?
Originally,
yeah,
when you first started smoking it, it just enhances every feeling that you're feeling. So with sex, it's good. If you're feeling hungry,
yeah,
you're ravenous. But now, it's just nothing like that.
Yeah.
So do you have a dealer and everything?
I wouldn't tell you where that
No.
Thank you very much. We'll get you in.
I thought I've lost you. She was lovely, wasn't she? She was.
Alpha 122, just want to thank you for that last job. How was Kathleen?
She was hilarious.
Yeah.
She was telling us how she smokes wacky-backy, as she calls it. I called her the Snoop Dogg of Blackpool, and she went, oh, no, I don't know who that is. I don't do comedians.
Oh, bless her.
The D-O-double-G. Snoop Dogg. Snoop Doggy Dog. Control to all South Cumbria crews. Anybody else to clear or become available for a Category 1 in Lancaster. That's a Cat 1 in Lancaster, please.
7 hours into the shift, and there is a shortage of ambulances as 58 crews are waiting at hospitals to hand over patients.
And how long have you been on the floor for?
It's about 2 hours now. I can't put any pressure on my legs, you know, to get them to leave myself up.
Okay. I do need to let you know we are experiencing some severe delays at the moment of up to 7 hours and 30 minutes, okay?
No.
Unfortunately, we just are extremely busy at the moment.
Currently, 149 patients are waiting for ambulances to be allocated, and lower priority calls are now being told to make their own way to hospital.
What's happening with... She's trying to kill herself. It's OK. It's OK. We're going to get her some help, OK?
I'm sorry. It's okay. I just don't get any way out of it at all. Everybody's so horrible all the time. I just don't understand how everybody's meant to get through this feeling.
We're going to get you some help, OK? Just bear with me, OK?
Yep.
Do you think I should tell them about the wait time?
So, yeah, you need to tell them.
So I just need to make you aware that we are very busy. Is there any way that you can make your own way to the hospital?
I can drive, yeah.
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 Yeah? OK.
Okay.
Just keep talking to her, all right?
Are you all right? You did really well to carry on through it.
I'm quite young and I don't have much life experience. And just seeing what people are going through and you think to yourself, is this really what's going on in the world? I went to uni and I studied a law degree, but I'd wanted to join the ambulance service because I wanted to do something where I was actively helping people. I do feel like I have got quite a weight on my shoulders when I am talking to people sometimes, but once you've helped them and you can breathe after that call, like the weight has lifted off your shoulders because you know that you've helped that person.
Ambulance, is the patient breathing?
Yeah, just a bit. It's short of breath. Is that COVID and it's getting over it? It's asthmatic as well, and that doesn't help.
He sometimes starts to pass out, and then he comes round, but he's short of breath, and he can hardly talk to me.
Hey, how old is he, please?
76.
A Category 2 call from a man with a heart condition who is struggling to breathe has come in from Kendal.
Graham.
Hello.
Uniform 60 have requested to be stood down. They've got an issue with the brakes. They're going to go back and change vehicles.
Okie dokie.
The closest ambulance to the patient has just broken down. Control must now dispatch Alpha 169 from Lancaster, who are 22 miles away.
Alpha 169.
169, go ahead.
Yeah, apologies for the long run on this. One of the other vehicles has just broke down on us. 76-year-old male. He is conscious and breathing.
Stated in his fighting for breath. Just to let you know, he has got some chest and upper back pain.
And there is a potential COVID risk as well.
Yeah, perfect, no worries. Thank you very much for that, mate. That's much appreciated. Right, off to Kendal, up off to Cumbria. Have you ever tried Kendal mint cake before?
Yeah, it's so sweet. I was up at Kendal yesterday. My tattooist is there and I got some more tats.
Did you?
Yeah.
You got a new tattoo yesterday?
Yeah. I've got like 38 tattoos though, Jared, haven't I?
I don't know.
I've got an all-seeing eye on my wrist.
Is that new?
Yeah, I've got do it on my hand.
Do what?
Like, do just anything you want in life.
Is that not the Nike symbol?
No.
Yes, it is.
Well...
That's the Nike slogan.
I created it, hon. I might get a Nike tick next to it.
She's so young to go down to the pub. She's about 12.
I know, what's going on there?
I'm young in Cumbria.
I mean, to be fair, that was my childhood.
Was it?
Not me drinking, I mean, just going with my dad in the pub.
Oh, my gosh.
Yeah.
I remember telling my dad that I wanted to be a paramedic, and my dad laughed and said, "Pigs will fly before you become a paramedic." So I thought, do you know what, I'm going to go to college and want to be a hairdresser. But yeah, I always wanted to be a paramedic and tried hard and worked my way towards it. I applied for university, got a place, and found out I was pregnant with my first daughter. The way I grew up, for me, a mother and daughter bond is something that no amount of money can buy. So I didn't go to university.
Thank you.
Here we are.
Oh, we're amazing.
Now, going back to being a student is difficult. I've got 3 children and you work 12 hours a day. Come home and I've got an essay to do and assignments to plan. It's difficult to do, but sometimes I sit back and I think, I can't believe I've got where I am from where I was.
Hello.
It's something that, you know, I've wanted to do my whole entire life, and it's not just a job, it's a privilege to do.
Hi, Masha, Peter. What's been going on?
I started with COVID. He's been feeling sick all the time. He's had nothing to eat.
Right.
It's hitting 35, it's hitting cold sepsis markers. 35.
He's tacky at 130.
130 and he's respiring about 30 as well, so it's hitting cold sepsis markers.
So, Peter, tell me a little bit more about this chest pain you've got going on.
It gets me in here.
So it's right there. Does it radiate anywhere?
It goes in the middle of your shoulder blade. Yeah, I guess it, yeah, that's right. I've been...
Just going to pop these on.
Are you Kendal staff or...?
No, we're Lancaster.
Oh, right.
Kendal staff that were on the way apparently broke down on the way to you. That's why you've been waiting a little bit. Sorry.
Oh, that's all right.
So we've driven from Lancaster especially for you, Peter. So already, Peter, it's gonna be a trip up to the hospital.
Yeah.
No, unfortunately not. Because at the minute your heart rate's really fast.
Oh.
You're struggling to breathe. Although your oxygen levels are okay, you're struggling to breathe. Yeah. It just looks very tachycardic and a little bit metabolic, if I'm honest.
Peter, I've just seen your model railway. That's pretty impressive.
He used to have it all the way around.
Oh, did he?
Yeah, we had to go underneath. But yeah.
Have you not got an ambulance?
Yeah, of course I've got 2.
Where's an ambulance?
There.
Oh, I can see me.
And then we've got one over here. A little white one, I think.
Oh, lovely.
Yeah, it's his pride and joy, really.
Yeah.
Grab onto my arm there, Peter. Jared will get that chair as close as he can.
I've lived home since my wedding.
Have you not? Oh, well, there's no aisle here, Pete.
That would be 5 years in June?
Is that when you got married?
Yeah, that's when we got married, yeah.
Where did you meet at?
The residential home at Riverside. Riverside. His mum and my mum were friends. And we never met because we used to visit different times.
Oh, wow. And what are the chances?
My mum died at the Christmas. And
Oh,
then,
sweet.
I went down there to volunteer, carry on volunteering. And Nathan got us together. Because his mum died that night, you see. So.
Oh, God.
Yeah.
Are you all right, Peter?
Yeah, fine.
Peter, have you thought about buying a bungalow?
Yeah.
We've got the heating on, all right, sir.
Jared? Are you pre-alerting this, Jared?
Yeah, it's code sepsis.
Yeah.
Peter's closest hospital is only 3 miles away, but due to concern about his heart rate, they must make the 22-mile journey to the nearest emergency department at the Royal Lancaster Infirmary. 9 hours into the shift, and across the northwest, 144 people are waiting, with 50 ambulances stuck outside hospitals trying to hand over their patients.
Ambulance services, is the patient breathing?
Yeah.
Fell off his scooter. He fell off a scooter?
He's 16 years old. I think he's got a spinal injury. He's screaming in pain.
Spinal injury.
Neck, arms, can't move. He can't lift his arms up.
Blackpool-based Alpha 212 Gerard and Lauren are only 10 minutes away from the 16-year-old boy who has fallen off an e-scooter.
Hello. Not too bad. Where are we going? You all right, buddy? What's happened?
I don't know. I just remember skidding and then this woman passed me my scooter and I got back up. I don't remember how I landed.
It's an e-scooter as well. It's quite just a
How fast does it normally go?
It wasn't full speed because I pressed the brake and then I skidded. My arms are really hurting now.
Here, were you guys in
It feels like it's like the tension's like proper. I don't know.
Where in particular?
Down on the actual arm bit, like the actual bone. Yeah, all that whole. You know, like where?
Have you ever had gas and air before?
Yeah.
Yeah, it's quite a short-acting pain relief, okay.
I've never had gas and air.
So it's gonna be a trip up to hospital, all right? Because we don't know what damage you've done, and it might be muscular, but.
Oh fuck! I'm like off my head. I feel my chest has got muddy. Dinosaurs in it. Because I'm a gangster.
Oh,
God. I'm a PIMP. Woo! Put a tune on, Mum. I love gas and air though. You know they've got flavoured ones now. I want some. I've not tried it yet.
I heavily advise when you're at parties, please do not take nitrous oxide. Please.
Tried, honest to God, it's just what they're all into, and it's awful.
Yeah.
Because
You know someone who's had an experience on it. It's not good.
Well, it's his own fault.
When your lungs have collapsed or your brain's got damage.
Because he's doing whip after whip.
It just takes one time, Lenny, to
Doesn't
be
sound
fair.
great, that, mate, by the way.
Right, well, let me feel your spine then.
Yeah. Ah, fucking bastard, bitch.
Where's the pain?
My arm.
None
my right
in your back
arm.
when I'm pressing?
No.
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 Well, let's just get him on the bed. Right, do you reckon you can sit up now?
Yeah.
Right, go on then.
Go.
It's silly, Lenny. Stop being silly.
Fuck! I've never been in one of these.
Lift up those feet for me.
Well, let's hope this is the last time then.
Damn one.
So you have to put your feet down.
Oh, sound. Cheers, pal.
Lenny will make the 2-mile journey to Blackpool Victoria Hospital, where this week crews have experienced delays of up to 3.5 hours dropping off their patients.
How's it looking, Lauren?
There's a few waiting, by the looks of it.
Oh, did you just wait in the queue in the ambulance? Yeah.
So we're coming in with patient query right knee injury and right elbow injury. What's it looking like? Go on, give me the bad news or the bad news.
There's no room.
Yeah. So there's no space. No space in the atrium, no space in the A&E. So for now it's holding on here, okay?
which is...
Do you want me a sub by me?
I'm right, give me a shout, I'll be in the front if you need me.
Thank you. I'm on my phone now, Mum.
There's just a bit of traffic, all right, Peter, so it's making a bit of noise to get through the traffic.
Peter has made the 30-minute journey from Kendal to Lancaster.
What an absolute coincidence how you and Sandra met.
Oh no, the night my mum died, I was sitting on the balcony having a cup of tea with my sister and the matron.
Yeah.
And Sandra came through the gate. It was her balcony, she looked after her.
Right.
The first thing she said was, I didn't know I had 3 gnomes sitting on my balcony. I thought, well, she's a cheeky one. And that's how we got together.
Wow. What are the chances of that?
As Peter has indications of sepsis, he will be seen immediately.
You're right, good. Hello, love. Good, how are you?
But wait times for other crews to hand over patients in Lancaster are currently 41 minutes. In total, 70 ambulances across the northwest are now waiting outside hospitals.
What the hell is going on? Open broadcast to all Fylde Coast crews. Is anyone available for a Category 1 call in Fleetwood? Category 1 call in Fleetwood, thank you.
Alpha 112 have been waiting 40 minutes to hand over their patient Lenny at Blackpool Victoria Hospital.
Hi. So, because we've cleared your C-spine, the only concerns we've got is with this right elbow and the right knee, okay? It's going to be hours on the back of here, multiple hours. There's literally no space in A&E whatsoever. The hospital's rammed. There's polio patients that are going to consistently jump you all evening. There's no in-between about it. We can pop you in a chair and then you'll get sent straight through to minor injuries where you'll probably wait a lot less time and get an x-ray there and be seen by a doctor there.
It's going to be sore, but...
It's going to be sore.
It's up to you.
Yeah, once someone that's sitting down and chilling, I'll be all right.
OK, if you think so.
New call handler Sarah is in the last hour of her shift.
I mean, is your heart, like, still beating fine, or is it, like, pounding out your chest?
No, I think it's beating fine.
Not that I'm judging you, because everybody drinks Monster.
Something's happening.
I mean, it's not even reading it, it's off the chart. Press ready when you're ready.
Ambulance service, is the patient breathing?
I've no idea, I haven't seen it yet. Is it typhoid or tapered? I have no reason. I can't drive because I've sore double and I had to give up my car and driving ability.
Is it possible for me to speak to him?
I don't know the number of the room. It's a care home. And I've tried 11, which I thought it was, and the room is not occupied.
I think this is an old lady with, like, dementia.
I'll try and find out.
OK.
By going into the office.
OK.
Yeah, go into the office.
Yeah, go into the office.
Of the emergency.
She's very nice, but she's not interested.
Well, what I'll do is I'll get her to listen to me, OK?
They don't understand how it's happening. Yeah. It's technology. I don't understand. Hello?
Hello?
Yeah.
Are you the nurse?
Yes, without nothing happening. She does that often.
All right, OK. I'll get this ambulance cancelled, but if you do have any other concerns, then just call us back on 999, OK?
All right, thank you.
OK, thank you.
Yeah.
That was a fun one.
That was good, well done. That was difficult. Do you know what to stop it as?
Canfer.
Yes, well done.
Good evening, Graham.
Hello, how are you?
Not too bad, how are we?
I'm not too bad, thank you very much. It was all right up until about an hour, 2 hours ago.
By the end of the day shift, the North West Ambulance Service have received 2,565 calls.
Right, so how do you feel about that? Feel a bit more confident with some of them?
Yeah, I think that's really helped me, like, understand what I know, what I don't know. what areas I need to improve on.
Ready to come back and do it all again?
Yeah, thanks, Michaela.
Right, so drive safely, get a good sleep. Okay, keep your windows down, and well done.
Thanks, Michaela. It's been an adventure, hasn't it?
Take care, see you in a bit.
Bye.
BBC Radio Cumbria.
And on public transport, we have an issue on the trains. Services are at a stand on Northern between Barrow and Millen. This is due to the emergency services dealing with an incident.
Do we know any other details apart from this body's been found on the railway line?
Returning for the day shift is dispatcher Graham.
Just confirm, Network Rail have put a stop on the railway line. Right, OK, we are about 5 minutes away. Yes, last thing we need is today to carry on like that. Alpha 169, good morning.
Oh, Graham. Good morning,
Graham.
Also back on duty in Lancashire are Alpha 169 crew Jared and Asher.
How is dispatch going this morning?
I won't lie, first job is not a good one, but hopefully it'll get better. How are we today?
Hope you're all right after that first one. We are very good. We've got coffee, which is what we're living off. This is how we're surviving. The NHS is running on caffeine today.
NHS runs on caffeine every day, not just today.
So just to confirm, have you been bleeding very heavily in the last 2 hours? Would you say it was gushing out?
Yeah.
Yeah.
We have organised that help for your daughter, but due to severe pressures, we are experiencing a high demand.
There are 55 call handlers covering the northwest, all actively triaging a 999 call. 12 emergency calls have no one available to answer them.
Oh, why are calls queuing? Was it that bad yesterday? Probably not. Yeah. Man.
All I know is that the other pupils told us that she's taken a lot of the antidepressants.
An ambulance will be provided as soon as possible. However, it is likely that this could be around 4.5 hours at the moment.
4.5 hours?
Yes.
Ambulance service, is the patient breathing?
Yeah. Don't ask me all those stupid questions again. I need help. I've got mental health history, right?
Yeah.
I need to speak to a doctor right fucking now.
All right, well, I'm going to try and help you the best that I can, OK? So try and keep the language down for me.
Well, I'm sorry, but you're all taking it personally. I'm trying to be assertive. It's not words, right? And I'm losing my temper. I'm going to keep you on this phone until you help me, yeah?
Annie, I'm trying to help you, but you need to answer my questions for me to do that.
Right, well, ask me relevant questions then.
And in the last 24 hours, have you had any crushing or severe aching pains in your chest, upper
Look,
back, or
I'll
upper
answer
abdomen?
questions, but I want you to know that this is completely irrelevant, yeah? I've had no crushing sensation, no, it's irrelevant.
OK, so again, I do just need to rule out other symptoms and conditions, OK?
But I've been through this 20 times already.
Right, but
you've got me holding up in emergency line here.
Right, but you haven't gone through to me because I've not spoken to you before, so I don't know what's happening.
Yeah, but everybody keeps saying the same thing, and you keep saying that.
That is...
You keep saying you haven't spoken to me. I'm trying to help. Don't lose your temper. Lower your voice. Yeah?
But there's no need to shout at us. All we're doing is trying to help you.
I don't want to wait 4.5 hours, yeah? I'm too desperate.
And again, I understand that. Right, so I understand you don't want to wait 4.5 hours. Unfortunately, that is our wait time at the moment because we are extremely busy. It may not take that long.
You don't even know how vulnerable I am.
You've told me how vulnerable you are, and that's why I'm helping you.
Well, why are you leaving me to my own devices then?
Because I can't stay on the phone with you when we've got calls queuing. If I could, I would do, but I can't do that. But you phoned an emergency line now, asking me to stay on the phone with you. No, and I get that.
You wouldn't do anything.
Right, so now I've done something and I've arranged the ambulance for you. Again, shouting at me is not going to help. I've done what I could do, and I've arranged the ambulance to come out and see you and assess you to try to provide that help for you.
I'm going to have your job, mate. I'm going to have your job, yeah?
All right, no problem. You take care.
Right.
It's Sarah's final shift of the week as she nears the end of her training. She will be mentored by Jenna.
Is there anything that you're dreading when that beep comes? What
Yes.
calls are you dreading?
Childbirth or labour calls, any cardiac arrests, or like, you know, like anything to do with like children when they like have injuries or unconscious or anything like that. I think that would scare me.
You'll do it, and when it comes, you'll be fine. Just part and parcel of the job, aren't they?
At the beginning of the shift, Control are receiving 126 calls an hour and 123 patients are already waiting for an ambulance to be allocated.
Ambulance service, is the patient breathing? Breathing. Oh, for God's sake. Yeah, he's breathing. Is he awake? No, he's got anaphylaxis, I think. His little boy was on the bus.
Alpha 169, this category 1, I've no age or sex for you this moment in time. Patient's not conscious, they are breathing. They're querying anaphylaxis. Please.
2 minutes away.
Yeah, no worries, we're near enough on Scott for throwing over.
Oh, pull back in or somebody move that way.
Alpha 169.
Go ahead.
Yeah, we've got an abandoned call as well. It's plotting outside St Paul's Church.
This is St Paul's Church.
Is that St Paul's?
Yeah, it's going through now. It's 1-year-old male, not conscious, but is breathing. Did you say you've got somebody there waving you down?
Not yet, no,
we're
there's a
just
church
looking.
here.
Can you send an SP as well, please?
Yeah, we'll pop an SP in for you now.
A senior paramedic with advanced level training has also been dispatched to assist with the unconscious 1-year-old.
Can you get him to call them back? So can they hear the sirens?
Alpha 169.
Go ahead. Oh, there.
Yeah, have you managed to make patient contact yet?
Yeah, we found him. Do you want to grab the bag, Asha?
Yeah.
Hello, sweet. My name's Jared. What's little man called? Reuben.
But
Hey,
expecting
sweet.
us at the day assessment unit because
Right.
he was having hives and things around his mouth.
Yeah.
But he started coughing.
Sorry, the hives. Come on, Reuben, let's get you on the ambulance, buddy. You gonna come up with me? No, you're all right. Hello. How are you? Can you see the ambulance?
169, yeah, that's confirmed. We've received patient. That's all received. Wonderful, thank you.
Trying to get the bus, and we thought he just touched something that he shouldn't have, and he had like hives.
You
around
can
his
see, I
mouth.
can see the hives there.
But we've given him 2 doses of cetirizine.
You just keep him distracted and we'll work around you.
Hello. This is Ian. He's works with us, one of our colleagues.
Allergic reaction over the last sort of couple of days. We've had a couple of doses of cetirizine. We're just about to get onto the bus.
I was
You're on
already
the bus.
That's why we got off at Lily Grove, because he started like flopping, but then he was coughing, and then it got to a point where his head was back, but he was like doing this, and I sort of panicked, and at that point I got him out of his pram and was trying to wake him up, but he just wasn't waking up.
So he's been hospitalised in the past following these allergic reactions, is he?
Not since he was 6 months.
And what reaction did he have then?
He had anaphylaxis to milk.
Full on airway swelling. Scary.
Very much so.
Well done, well done. You didn't even cry.
And then we got
What a brave.
strawberries again.
Is that normal for him to drill that much?
No, not really.
Oh, we've nearly done that blood pressure as well, you little monkey.
Scratching away, little man. There we go, perfect.
Are you just trying to scare the hell out of your mum?
Listen, we'd rather this.
Yeah, 100%.
We would rather this now than totally recuperate and be fine when they're with us. So you've done the right thing 100%. Shall we have a drive up to the hospital, Reuben?
Thank you very much, love. Much
Thanks, Ian.
appreciated. Bye, love.
Bye. Let me know when you're ready, Jared.
Yeah, good to go in your arse, mate. So it probably shows that there has potentially been some sort of a reaction because of the increase in the mucus coming from his mouth. And I say he's itching his legs and whatnot, his arms a bit more. So there's probably has been some sort of unknown allergen.
Reuben will make the 1-mile journey to the Royal Lancaster Infirmary.
What are we looking at now?
Yeah, we can rock and roll down to Peds. They're fine. We're checking in afterwards.
Oh, you're amazing. Thank you for that.
Jared's a professional at this, so he'll sort everything out, get him in.
You couldn't do that, Asha?
Oh, has he just been sick? Oh, no, he's just a bit drooly. Quite a lot.
Very kind. Well, that was a bit of drama. Thank God he wasn't overly unwell. The bus driver could have pulled over, hazard lights on, and we would have got to a minute sooner if he was really, really unwell.
Yeah,
a
minute is a fucking long
with
time.
babies.
When I had Beatrice, my second one, she was 3 weeks old. She was in a cot next to the bed, and I don't know why, but I couldn't sleep. And I looked over, and she was blue in a cot, like, and I mean blue. She wasn't breathing. Got to hospital, and she'd roused round a bit. But in front of the doctor, she stopped breathing, and they put her on a monitor, and they got a resus team straight away. Heart rate had dropped to like 40, which is massive in newborns.
Oh, well,
like, there should be like 160
yeah,
at
well,
heart
at
rate.
40, you start compressions at 40.
So they put her on a ventilator, and I thought she was going to die. And I think afterwards, I got really bad PTSD, and I didn't realise it for a long time. I'm still having counselling now, actually. And even though he was fine, I think...
You just hear 1-year-old not breathing.
Yeah, and I see the panic in his mum's face. Thanks. And I think that's... I get where you are, like, and she was like, I'm so sorry that he's not unwell. And I was like, we don't want him unwell.
We want a well baby.
We want you to say, oh my God, it's a false alarm,
Yeah.
than go through what me and Steve went through. People say to you, like, what's the worst thing you can go to? It's not, you know, what people probably think in their minds.
Yeah.
It's little things that struck...
A personal chord.
Yeah, they struck a personal chord with you. So I think, yeah, that's why it always fixed. Yeah, I'm good.
Yeah?
Good, thanks.
Good, because you've got some paperwork to do.
The job never ends.
Job never ends, sis.
7 hours into the day shift, and control have taken over 1,600 calls from patients needing an ambulance.
Right, let's see what the next thing calls.
A stubbed toe, please.
Ambulance service, is the patient breathing?
She is, yeah. She's 2 years of age.
OK, can you tell me exactly what's happened?
She's had a bath and she picked a bottle of shampoo in the water and then drank it. We're just going to take her to the walking centre. She's just keeled over on her front. I can't.
Right, OK. You've done the right thing. We are going to get the help sorted for you. Is she choking right now?
No.
No.
She's struggling to breathe.
OK, we'll be coming as quickly as we can, OK? Just stay calm for me, OK? Because that'll help her, all right?
She's got really brave.
OK. An emergency ambulance is being arranged and they are coming on blue lights, OK? Do you need advice on how to give basic life support?
It's okay. You're doing really, really well, all right? Just ask her again.
Emily, can you hear me? What I want you to do is lay Florence on her back on a flat, hard surface, OK? And kneel by her side. Can you hear me, Emily?
On her back. She's been around.
You're doing really, really well, OK? Is she responding to you yet?
She's just opened her eyes. Can you tell?
OK, so is she responding?
Yeah. Don't close your eyes. Don't close your eyes.
Just keep talking.
Just keep talking to her, OK?
Can you sit up, Florence? Oh, no. I don't sit up.
We are coming as quickly as we can for you, Emily, all right? If there are any new symptoms or if her condition gets worse, changes, or you have any other concerns, call us back on 999, OK? We'll be with you as quickly as we can, all right? You take care, Emily.
Okay.
All right.
Okay.
Yes, all right. Honestly, you did really well with that. She's all right. She's conscious. She's breathing. Like, that, I can't believe we just asked you what would you dread, and then it came through. Hey, come on. Honestly, you did really, really well with that. Come on. Let's go outside. Come on. Another breather. What? Another breather.
when I'm listening to callers and they are quite distressed and they are crying, I do cry along with them. Because I'm so invested. I am a family member, I am in that house. And it feels like I'm in a box, in a room, and I can't get out to help them. They said you need to like distance yourself a little bit. That caller needs you to be calm and collected and be able to help them in that situation. And I think I'm slowly starting to become a bit more resilient. But I think that'll come with time.
There's nothing you could tell me that would make me walk away. 'Cause in my eyes you're perfect and there's nothing I would change.
Ambulance service, is the patient breathing?
On your best days and I'll see you on your worst, my love.
So an ambulance is being arranged for him, okay? Currently, slightly, this could be over 45 minutes, all right? Yeah, and if Aubrey does get any new symptoms or his condition gets worse, changes, if you've got any other concerns at all, just call us back on 999, okay? Thanks for your call, take care.
I feel like a proud parent. I didn't say anything in that.
Did you not?
No.
I didn't even realise I was
I
doing.
didn't say a thing in that. You did the whole of that yourself. I can retire now.
Eventually, I do want to become a paramedic, and I think this job and just working my way up will help me.
Like I said, wobbles are completely normal. You come into this because you're a caring person.
Yeah.
Caring people have wobbles because they want to make sure they're doing it right for the patient, don't they, at the end of the day?
Yeah.
I can't put into words how much of an honour my job is, because it's personal. Because I've been there and I know how it feels. It's the most important thing we'll ever own is life, and I will help you in any way I can.
I'll be here if you need love, if you need strength. Forever by your side until the end. With me you really don't have to pretend. It's all okay. If you're not okay, I'll be there, my love. I'll be there, my love. I'll be there, my love.